Welcome back to American Medicine Today. I'm alongside Dr. Alfred Bonati. We have something called chronic pain. For people that may not understand what it is, define it for us.
Chronic pain is something that is constant. It's a lot of population that has chronic pain. And in the world, 30% of the world has some sort of pain.
30%.
30% of the world has some pain. If that pain persists, become chronic pain.
Okay.
And then you need to find the etiology of that, why this happened, or why is this patient with this pain. Once you find it, then you can correct it.
Correct.
Or at least you can treat it and decrease the amount of pain. And in a spine surgery, maybe orthopedics and neurosurgeons see most of the chronic pain on the spine.
Why do you think it's so many? Is that because people are often misdiagnosed?
I think the cause is because it's trauma. We live in a trauma society. Okay, you look at the amount of accidents that we have in cars in the country. Chronic pain can be associated with accidents when the people has a flexion extension injury of the neck, and then they have shoulder pain, and then they have neck pain, and doesn't go away.
Are you talking about, say, whiplash, something like that?
Whiplash injury is one type of a syndrome
Okay.
that happens after that. But some other times, it's not only the whiplash what produces that pain. It's sometimes the impact. When you're trying to stop, you put your foot down, and then put the brake, and then you have the impact, and then you have an impact in your hip, and that produces hip pain. Then or destroy the bone or damage the joint. Those are things that happen in life by accidents. Then exercises. People try to exercise to lose weight, and they are not prepared really to put the stress, and they create a problem, and then suddenly they damage something.
Yeah.
Those are things that happen in life by accidents, by war. Imagine the soldiers that they go to a war, and when they come back with an amputation, and then that amputee, if the areas of the amputation were not done, sometimes you do have stumps that they are with neuromas.
Ooh.
The neuroma is an extension of the nerve who's trying to grow to continue becoming a long nerve, but doesn't find the area where it needs to go, and then become like a tumor. And that neuroma is extremely painful. Then the patient's in a constant pain.
So again, how do you treat that type of chronic pain?
Well, you need to have a clear diagnosis of what is the problem.
Yes.
When you have a neuroma, you know what you need to do. You need to remove the neuroma and make some type of treatment the area so the neuroma will not regenerate. When you have an accident with flexion extension injury on the neck, you need to correct the areas that they were damaged, that they are now ligaments and they are muscle, and sometimes are herniated discs, all this. And there are techniques, treatments like physical therapy and things like that, that they help. But on the back, specific on the back, every one of us develop very small traumas through life. You are walking on the street, you step off the side of the curb, and then you twist your back. The first thing that you do is you say, oh, my back is killing me with these couple of steps now. And then the next thing that happens is that is a type of trauma that happens between the attachment of the annulus and the bone in the vertebra. And when you do that, it's a little bit of bleeding there.
Okay.
In a day or so, that becomes like a scar. Then in few weeks, it's a scar. And in a month or so, 2, 3, 4 months, becomes like a cartilaginous scar. And if you continue with that one without any solution to it, then that one become an osteophyte. That means it's a piece of bone, like the people identify like a spur. When that spur starts to grow, because has possibilities to grow, is free in the canal. When grows, then it's going to touch a nerve or a spinal cord. And when that happens, you start to develop pain. And that pain becomes chronic.
And I can't imagine that would be comfortable, because then it's impinging on nerves at that point, right?
Well, and if you develop that one in different levels, because the trauma doesn't happen specific in one level, specific goes usually in 3 areas. And then when that happens, those areas start to hurt. If you ignore that one, now you start to develop some deficit on the nerves. And some people will start to go from the back pain to start to have now neurological components that they've been involved. And those ones now they will start to hurt and will increase the pain. Sometimes require surgery, sometimes require treatment, sometimes some therapy. But no matter what, that thing is impinging and touching in a structure that is going to hurt. So if that thing continue, then become numbness. And if it continue, become paralysis. Then suddenly you start to see that your fingers don't have power. Some people come over and say, I tried to grab a glass from the refrigerator and I escaped from my hand and
no strength.
Straight in the floor.
Yeah.
So when that happened, the muscles are not being informed by the brain because the nerves are not connected towards the muscles with all the impulses that are necessary to create the force that needs to grab that glass. So that situation starts to become more important when it happens on your hands, or more important when it happens in your legs.
Yes.
Because then suddenly you stop walking. And if you see people on the mall sometimes that they're walking with a cane, other ones are scratching the floor, just shuffling, and other people are trying to use walkers, and some other people are in a wheelchair.
Right.
So those are different stages of chronic pain that create this problem and then suddenly put you in a wheelchair.
So it's not something you can just live with without it highly impacting your livelihood.
That is one of the major problems on education. Because it's not something that is so intense that people think they are getting old and that is normal, and then allow this to happen.
And that's shameful, because when you can be treated by procedures in the marketplace, and specifically the Bonati spine procedures, you shouldn't live in that fashion. Thank you for joining us on this episode of American Medicine Today. You can catch us anytime on our streaming app. Just look up AMT.